at the... All right.
Okay.
Hello, everybody. Hi, Iris.
Hello, hello.
My name is Bartosz Chmielnicki, and today I invited for a short meeting our friend from Israel, Iris Abarbanel, and she is a very experienced practitioner and teacher of East Asian medicine, including some Japanese techniques, which are interesting for us and which seem to be very, very fascinating. The name might be a bit funny for Polish audience. Anpuku doesn't sound very serious for us.
Yeah.
What...
Also in Hebrew, it doesn't sound serious. It's okay.
Good, good. So then, can you tell me what is Anpuku? What kind of method is it?
Okay, so Anpuku, first of all, the word itself combines two words, two kanjis. Anpuku. An is from the word anma also. It's like pressure, rubbing, making rotations, and hands-on techniques, manual techniques. And puku is the abdomen. When we work on it together, when we say it together, Anpuku means acupressure on the abdomen in general. But the beautiful thing with Anpuku is that it's not just pressure. There are many techniques. And what I'm going to teach in our seminar in the end of November is going to be very practical and going to be oriented to, first of all, understanding the diagnosis of Ota Sensei. The old texts that remain from the Edo period in Japan are mainly of Ota Sensei. And in his books and books that mention it from for example, Anmatebiki and things that came from Japan in the Edo period, highlighting 13 techniques. 13 techniques and the abdomen diagnosis, which is very, very old. It's pre-shiatsu abdomen that most people know. It's talking about parameters that are regarding harmony and disharmony in general of the abdomen, and like pulse and lamps and temperature and things that, of course, I'm going to explain how to work and how to diagnose in the seminar. But my wish is to, because I really like to do as much as possible in a short time that I'm going to stay, so is to teach not only 13 techniques from the Anpuku Zukai, the text that remained, also from another master, Master Goto, which is also abdomen techniques, which are not only on the channels, also on directed to organs. And when I think about what kind of people come to my clinic, it was something that was built and also transformed in the last 20 years that I'm working, because I'm working not only with Anpuku, of course, but when I'm thinking about the way I use Anpuku in the clinic, it's going from abdomen issues like chronic things, from Crohn, colitis, things around it, IBS, pregnancy, fertility issues, also maintenance in the pregnancy itself. And I'm going to teach it in the seminar. I really want to teach it in the seminar. So it's not like a full course, the full course that I'm doing in Israel, which is, it's of course longer, but I really want to give you the option to see how to combine it into your clinic, into your Chinese medicine, even if you're working mainly with acupuncture or herbs, you can totally combine it. And it can stand alone, but it can also be combined.
Great. So basically, we are talking on some kind of manual technique you do on the abdomen, which is based off old Japanese ideas from 17th, 18th century, from
Yes.
Edo period. Great. And you mentioned diagnosis. So during the seminar, you will teach us both the way of diagnose the abdomen by palpation and the way of
Yes.
treatments.
Yes, I'm going to teach diagnose by palpation and techniques from Ota Sensei regarding this specific diagnosis, and also Goto Sensei, and part of the work with the abdomen regarding trauma work, which over there, this is a combination that I'm doing because I'm also a SEP, a somatic experiencing practitioner, and I'm working a lot with shock trauma and development trauma. And as we know, it's all over the world. And when
Israel is a perfect place to learn this.
yes, to learn, to teach, to work. Yeah, unfortunately, and this is very strong here. And working with the abdomen is something that we have to know how to contain and hold the emotional space, and especially the somatic emotional space, which is totally hidden in the abdomen due to the way the enteric nervous system works, the way it's connected to the second, the brain, and all the idea of the second brain. I'm going to highlight it when we meet. I'm not going to teach it to the depths of it. Of course, we don't have enough time for it. I wish I had, but next time maybe we'll do a continuous work on the vagus nerve.
I'm thinking now you are talking about this technique and abdomen and trauma, and just yesterday I have had this patient, a young girl, 16-year-old. She came to my clinic 3 weeks ago with totally ununderstandable pains in the abdomen. And, half of the practitioners say she is mental and it's only stress and, young girl. So it's obvious, it's just IBS, nothing else. But I have this feeling it might be after a kind of infection or something. So I'm really curious if your way of diagnosis and touching the abdomen of this young patient could help me to recognize how much is more the emotional part of this pain and how much is more the physical post infection kind of pain in the abdomen. That's fascinating.
This is a very good question, I have to say. And first of all, if you will have the option, if she wants to join us and we do a demo on her, I'll be more than happy to help.
I'm not sure if she comes to Warsaw. It's 350 kilometers.
Okay. But anyway, in general, when I diagnose, I also do, of course, like therapy diagnosis, like I'm doing. And we're talking also about the body reading of how you diagnose the space behind the words.
Great.
So this is something that is very important, because you can't just look at the way, things are only shown by the palpitation, but there is a lot of connection to it, and I give a lot of weight to the palpitation. And I'm working mainly somatic emotional issues. So every time somebody is coming to my clinic, even if it's just orthopedic or just stress, the stress is coming and building up because of something, and we can see the root. The abdomen is working and directed to the root of everything. So by clearing and talking about it, and of course working manually with it and other tools, if we want to like combine other tools, then we can address, for example, this girl by also working on the infection, but also on the patterns and the root that brought to this infection. Because if we only treat the infection, great, we solve the symptoms. But there is a reason why a 16-year-old gets so much tensed, from the way she's built, from the way she handles her life, from the way life meets her. How can we help her build more stability, more strength inside, and more connection to her own root and core? And the abdomen is core.
Perfect. You mentioned core and center, because this is how we called your seminar, actually, supporting the center, helping the center, soothing the center, because I do believe this is the way in many cases to really healing process, very deep healing process.
That's the root healing process. First of all, we need to connect our own center to be able to digest in all levels, the environment that we live in. Because Yeah.
Chris, the question is, many people ask us this question. Who can attend? I mean, do you need to be postgraduate after the whole Chinese medicine knowledge with perfect pulse diagnosis, or it can be students or people who do work with the body of other people, like physiotherapists and so on, but who are not so well trained in Chinese medicine?
Okay, that's a good one, because when I studied Anpuku, it was the first thing I studied. I didn't know anything from Chinese medicine before. So what I ask from my student is to have the ability and knowledge of how to touch. So if they have reflexological background or physiotherapy background, of course, anatomy, and the Chinese medicine graduate, or like say third year students, it's great. But I'm not only talking about channels. And when I'm talking about channels, I will always say, for example, the kidney channel, but a finger from the belly button, for example. Video. So it doesn't have to be a full Chinese background. No, it needs to be with a very deep understanding that touching the abdomen is not a regular and something that is just a technique. The emotional holding must be very strong idea inside of you as a therapist. When you're touching the abdomen, it's something that I really talk about, okay, also a lot, because we have to come with a lot of respect and a lot of modesty to this area, okay, because it talks to us when we touch it, and we need to respect the pace of every patient, and there is pace. So of course physiotherapists can come, for sure physiotherapists can come, but it's very not just techniques, it's a bigger idea.
Wow, I'm really interested, and I think I will come myself. I just wanted to ask you, you started from that, so I do believe it's an important part of your practice. I wanted to ask you if you could estimate, roughly, what is the percentage of patients you use Anpuku on? I mean, is it something you do use every day, or is it something very special you use twice a month or something? Is it really?
I use it with every patient.
Oh, okay.
Every
Wow.
patient. Yes, because first of all, I'm working long-term processes, and sometimes a meeting will be only speech, speech, talk therapy. It will always be something that's connected to the body. Also, when it's talk therapy, it will always have something connected to psychotherapy, physical psychotherapy. But every client gets it at least, like I usually meet them once a week. Okay. Most of them, every session, there's a part of the abdomen. Let's say, for example, a meeting is an hour. Always there's a part of the talk. And when it's only talk, it's only talk. But when it's not only talk, it's like, for example, 20 minutes Anpuku. And if I'm doing extra things, then there are extra things. But most of the time, 20 minutes Anpuku in every session.
Wow. Okay. Yeah. So it is a useful technique. It's not something fancy from Japanese path. It's
very practical, very recommended to take it into the clinic. Like, for example, if you're using acupressure, then you can do it before you put the needles, after you put the needles. Think about, I all the time have students that combine, because I'm usually, this is like a continuous study. So it's all the time people are coming with their own tools. And I'm always saying it's very strong, so it can be a standalone, but it's amazingly combined into your practice. So you can combine one technique, one technique, you can combine a whole sentence of techniques, you can combine just the diagnosis, and you can have the whole thing. So, but it's really part of the system.
Great. I'm thinking of the patients. I'm sorry, I'm sick a bit, and every time patients are in my head, because I think between 20 and 40% of my patients every day, I do use some abdominal points, like the kidney points or renmai or stomach or spleen points. And now I think that maybe in these patients, before acupuncture, I could really touch, I could really make some kind of this Anpuku therapy ideas, techniques. And also, I believe in these patients who have got all the metabolic problems and intestines problems, and it is a lot of these patients in Poland right now.
Wow, okay, perfect.
Really, really, thousands of people have problems like that, and they are looking for help. And of course, Western medicine doesn't help so much because it's not something you can grasp. It's more functional,
Yeah,
dysfunction. So maybe in these patients, I can be even more successful with this technique than just with the needles, because
amazing.
sometimes I'm afraid also of putting the needles in the abdomen. It's, as you said, it is a very special area of our body.
Yeah, and you don't need to also work so physically deep. I'm also going to talk about the techniques are so smart. Like, for example, there's a technique of vibration. The vibration, you can hardly see it. When I'm teaching it, I'm asking the students, I don't want to see you move your hand. I want to touch your hand and feel the pulse like a polygraph needle. And it's
Okay.
working to the depths of the abdomen. It's working on the 8 extraordinary in ways that I'm also doing some modification on it, like working directly on the ovaries and on the wound itself. And things really, really go deep, and you don't have to dig in. I'm also doing visceral manipulation, like osteopathic. I hardly use it. Like, I think I most of the time use just Anpuku when I'm working on the abdomen, and sometimes I'm moving a bit the liver, like with the visceral. But it's very gentle. There are things that are not, it's not a spa. I'm always saying to my students, listen, some of the things are not going to be nice at the beginning, but we are here to help healing. So when things are stagnate, we are touching, of course, with the ability to understand the border and the limits of the patient. We're not trying to make things difficult. And there are also ways, I'm going to explain it, of how to work with people that don't like and don't want touching the abdomen. With children, I'm using many techniques of, like, this is a very sensitive area, but it's so important to touch it in many levels, because it's the center of everything.
So you mentioned pregnant women, ovaries, children, intestines. It's really like almost for everybody.
It's almost for everybody. Each one takes it to his own way of thinking. My route is the emotional route, and my passion is to helping to heal trauma. But you can also work only with gynecology. You can work only with abdomen and digestive system, anxiety, depression. Totally on it, because of the connections of the nervous system and breathing problems. Also, we are also working directly on the chest, because it's part of the ideas and techniques of the Anpuku. It's not only the abdomen, the lower abdomen. It's like the whole torso. We're working also on this area. And this is, for example, this part is a branch of the Chong. So there is something, directly to the Chong. And I really want to, I hope to teach like up to there are 30 techniques, not 13, 30 techniques. I'm aiming like to teach between 13 to 30 and the diagnosis. So be prepared for practical, a lot of work. Yeah.
Iris, it's great, having you here on Zoom. It's great listening to your enthusiasm and looking to your smile and eyes.
Thank you.
I'm sure all our students can make the body diagnosis also very well. So they can see it in you, this passion to help people. I don't want to take too much of your time. I know you are tired after the whole day of clinic. So So thank you very much for this time. One last thing I want to say to all the students who listen to us, or two things. First of all, there are only 6 places left because the group is very limited, very small, because this will be very practical with Iris. And second thing, if you have any questions, just let us know and we will ask directly Iris. As you can see, we can communicate, and Iris is really willing to share her great
Sure.
knowledge and experience. And I heard it is almost for each one patient in many, many different directions. So let's meet in Warsaw between November and December. Let's do this Christmas gift to all of us. And
Yes, please.
and yes, I really would like to invite you, Iris, and I can't wait, to having you here and working with you and learning this technique for the better diagnosis and practice with my patients in my clinic.
I'll be more than happy, and thank you for your time also, and for the warm welcome that I'm getting from you and your school, really.
Well, I'm sure we will see each other soon. I'm stopping the recording at the moment.